Again, welcome to Introduction to Health Informatics, HA135 course. These lectures will cover chapter 1 of our course textbook, and it's Healthcare Delivery Systems. Again, Unit 1 lectures. Our main objective is to summarize the history of medicine and also the delivery of healthcare in the US. Also, we are going to list programs and services offered as part of the Continuum of Care. We are also going to differentiate between for-profit and not-for-profit healthcare facility ownership. We are also going to differentiate among the healthcare providers and their disciplines. So we start with the history of medicine. And here we say that information about historical healthcare delivery practices comes primarily from the study of textual references, also artistic illustrations, and the study of human remains, which is again probably the most reliable source because of a less potential for written and artistic biases. While diagnosis and treatments associated with prehistoric and ancient medicines were mostly a product of ignorance and superstitions, an occasional discovery actually works. So here, during the prehistorical medicine period, there was a belief that angry gods or evil spirits caused disease, and tribal priests drove evil spirit from the body. This idea is still being practiced in some part of the world. But also this practice was during the Western civilization, that there's a belief that angry gods or evil spirits can cause a disease. So we have a score of fossils which suggests that trifling, which involve using a stone instrument to cut a hole in a patient's skull, was performed to release the evil spirits. And there was evidence on this. Also, plants may have been used to relieve pain. And this practice is also still going on in some part of the world where they use plants roots to cure diseases. And also the ancient medicine, we know that the world's first known physician is called Imhotep, lives 2650 BC. Imhotep was also the world's first acknowledged architect and also built the Egypt's first pyramid. History shows that he was the first physician. During the Middle Ages also, there was a development which were characterized by lack of education, except among nobility and most wealthy. And the most significant medical development was the construction of hospitals to care for the sick, often managed by monks and nuns. The care of patients was based on charity rather than on scientific principles. This is during the Middle Ages. The first hospitals were created in Baghdad, Cairo, Damascus, and monastic orders built hospitals in Near East to care for wounded crusaders. So the first medical school was established in Salerno, Italy, and during the 11th century, universities were founded in Bologna, Montpellier, Oxford, and also Paris. And during the Renaissance medicine period, this mostly associated with Europe, was characterized by renowned interest in the arts, science, and philosophy. And this was the beginning of, again, modern medicine based on education instead of spiritual beliefs. And Ambrose Pell became the greatest surgeon and then surgical writer of the Renaissance, when, after being rejected by medical schools, he was educated by the army on the battlefields, and also he saved thousands of lives by ending the use of burning oil to cleanse wounds and teaching the use of linkages in amputations. Also, laws against dissertation were relaxed during the Renaissance period in medicine, and also the first scientific studies of human body began. This mostly related to Western world, which is again Europe. This leads us to the modern medicine, which include the implementation of standards for sanitation, ventilation, hygiene, and nutrition. In addition, choosing the healthcare as a profession became more acceptable. Hospitals were reformed and the training of physicians and nurses improved. William Harvey proved the continuous circulation of the blood within a contained system. Also, Asselin discovered lymphatic vessels through experiments on animals, which leading to a theory attributing cancer to lymph abnormalities. Also, a Dutch amateur scientist began using a microscope to study organisms that are invisible to the naked eye. Now it's called a microorganism or microbes or germs. So the evolution of healthcare delivery system in US, the earlier hospital in US was established in Pennsylvania. So Pennsylvania Hospital was founded by Benjamin Franklin, and this was built in 1751. And that was the first US hospital. Then by 1761, a surgeon named John Morgan organized the medical faculty at the University of Pennsylvania, thereby creating United States' first medical school. And it was based on a curriculum that combined instructions in the arts and also the classic with practical knowledge necessary to make a living. And this would be the earlier quality of care initiatives. And also the federal initiatives, the federal government also, again, put more support on the program. And so what is a continuum of care? Here we say that a complete range of programs and services is called a continuum of care, with the type of healthcare indicating the healthcare services provided. So a continuum of care contains 3 levels: the primary, secondary, and also the tertiary. So with the primary care, services will include preventive and acute care, which also refer to as a point of first contact. These are provided by a general practitioner or other healthcare professional. Example can be a nurse practitioner who has first contact with the patient seeking medical treatment, including general, dental, pharmaceutical services. The secondary care normally are services that are provided by medical specialists or hospital staff members to a patient whose primary care was provided by a general practitioner who first diagnosed or treated the patient. And this will be the primary care provider, refers the patient to the specialist. So secondary care normally will be specialist doctors that are normally referred by their primary doctors. Then we have the tertiary care. These are services that are provided by specialist hospitals equipped with diagnostic and treatment facility, not generally available at hospitals other than primary teaching hospitals or level 1, 2, 3, or 4 trauma centers. We also have what we call the quaternary care. Quaternary care, again, is an extension of the tertiary care, and it includes the advanced level of medicine that are highly specialized, not only widely used, but including experimental medicine, and is very costly. So quaternary care, again, is not widely used, but very costly also. Now, the healthcare facility ownership, we have different types. First is the government. At this present modern society, we have healthcare for the government, which is not-for-profit organizations. We have the proprietary also, which is for profit. Sometimes the corporations also may have more than one hospital or healthcare facilities in more than one state. So not-for-profit normally represent around 25% of all healthcare facilities in US. And normally supported by the local or regional or federal taxes, and also operated by the local, state, or federal government. Example of a federal government healthcare facility would be the VA, Veterans Hospital, or the VA Hospital. Each local, for example, in New York City, we have some hospitals that are getting funded by city government or city taxes. Example can be a Kings County Hospital in Brooklyn, New York. Now, a proprietary hospital, as we said, is for profit, normally represent only 15% of all healthcare facilities in US, and they are for profit. And this can be owned by corporations. Example would be Humana, which is a corporation that owns healthcare facility in different states. Also, sometimes we may have a partnership. Maybe we may have 2 or 3 or more physicians that go into a partnership business and open their own clinic or healthcare facility. Or we can also have a private foundations, may have their own hospital. Example, yes, Tarpon Spring Hospital Foundation Incorporated. And as we said, corporations often own a chain of hospitals located in several states. They may also own a nursing homes and other types of healthcare facility as well. We also have a voluntary healthcare facilities. Also is not for profit, but government is not for profit, which is normally operated by the government officials through taxes, etc. By voluntary normally represents 60% of all healthcare facility in US, and they are not for profit. But these hospitals normally are operated by a religious group like Roman Catholic or Jewish Center, etc., and other voluntary groups also. But in US, mostly religious groups operate voluntary healthcare facilities. We also have a teaching hospitals. And teaching hospitals can be government, which is not for profit, or it can also be a proprietary for profit. Example, a private university may have a medical school, and through medical school, they may have a teaching hospital. Normally in teaching hospital, we have doctors that just graduated from medical school. They don't have much experience. So through these teaching hospitals, they may do their residence or housemanship and gain some experience. So this includes 24-hour access to physician care and the latest therapies in addition to treating patients. They are training sites for physicians. So most, again, teaching hospitals have doctors who are still on training. We also have the healthcare facility organization structure and their operations. Healthcare facility in US is almost the same as any business organization. We may have the governing board, for example, the board of trustees or board of governors or board of directors, it depends. And normally they will serve without pay, as many business organizations in US. And its membership is represented by professionals from the business community. And it has ultimate legal authority and responsibility for the hospital's operation and is responsible for the quality of care administered to patients. We may also have the hospital administrations. which is again the same as any type of business organization administrations. And they normally will serve as a liaison between the medical staff and also the governing body or the board of directors or board of governors, etc. And they are responsible for developing a strategic plan for supporting the mission and goals of the organizations. So an example of an hospital administrator can be the president or the vice president of a specific department of the hospital or the general hospital, or chief executive officer, chief information officer, etc. Also, we have healthcare facilities, organization, structure, and operations. These are some of the positions as we mentioned. Chief financial officer. Normally, chief financial officer will be responsible for financial operations, such as accounting, billing, payroll, insurance, etc. And then we have chief information officer. Chief information officer will be responsible for information resources management, information pertaining to finance or administrative or general medical operations. And then we also have the chief operation officer, which is responsible for overseeing specific departments. We also have a medical staff. Normally, medical staff will be nurses, doctors, physician assistants, etc. They normally have a license to practice in their specific field. So here we say medical staff consists of a licensed physicians and other licensed providers as permitted by law. Example can be the nurse practitioners or physician assistants who are granted clinical privileges, which are license to practice. The hospital department, services, and communities, we may have a quality patient care delivery that require the coordinate effort of hospital departments, contract services, and also hospital committees. Hospital departments can include those that provide direct patient care as well as auxiliary. Example can be a clinical lab or the emergency room or ICU, patient administration office, etc. Insurance department. So this is a typical hospital organization chart. Again, there may be a difference with different hospitals, but this is a general idea. So we start with the governing board. This can be the board of directors or board of governors. And they normally serve without a pay, and normally they will be working, they are professionals in other organizations. Then we have the administration. So in the administration section, we may have, for example, the CEO or the president, and chief information officer or chief financial officer, etc. They oversee and make sure the goal and objective or the mission of the hospital is achieved. They come up with a strategic plan for that. And they will act as a liaison between the staffs. Here we can see the medical staffs and the governing body. So the medical staff depends on the field of studies. We have the diagnostic services, therapeutic services, environmental and physical plan, general service can be billing, human resources, medical lab, patient education, etc. Diagnostic service can be audiology or even cardiology, emergency room, laboratory. So this will be mostly medical departments. So these are some of the healthcare information department. We have the department administrations. Each department may have different objective, different field of study, professional field, etc. We have the cancer registry, coding and abstracting, image processing. Normally this will be X-ray, data that can be again processed digitally, incomplete record processing, and also medical transcription. Medical facility also involve license issues, regulations, and accreditations. So first, the Code of Federal Regulations. We said here, every state laws require that healthcare facilities and providers in US to obtain a license. That's a license to operate or practice medicine. Example would be the nurses, physicians, they must have it before providing healthcare services to the patient population. Also, a State Department of Healthcare issues the license. The Department of the Health of the state will issue the license, which requires facilities and providers to comply with the state laws and regulations. License can be revoked if, again, a physician or a nurse is found guilty of malpractice or didn't do the job right. We also have the Federal Registration, Accreditation Standard and Surveys. So accreditation normally is a voluntary process that a healthcare facility or organization, such as a hospital, undergoes to demonstrate that it has met the standard beyond those required by law to be the facility to be accredited. So normally license is related to the professionals, the medical staffs. Accreditation related to the healthcare facilities. And do they practice hygiene well, ventilation, equipment, everything is up to standard. We also have a survey, which is an evaluation process that is conducted both off-site. Example would be hospital submit a self-study document for review, or on-site at the hospital to determine whether the facility complies with the standard. So when a facility undergoes accreditation, it communicates to the public that it is willing to go above and beyond what is required to offer a best quality healthcare possible. And these are some of the few accrediting organizations in US. We have Accreditation Association for Ambulatory Healthcare, American Osteopathic Association, Commission on Accreditation of Rehabilitation Facility, also Community Health Accreditation Program. So accrediting organizations such as Joint Commission, this is formerly known as Joint Commission on Accreditation of Healthcare Organizations. We also have National Committee for Quality Assurance, National Commission on Correctional Healthcare, and National Integrated Accreditation for Healthcare Organizations. These are some of the few recent legislation pertaining to healthcare delivery system. There was a 2005 legislation, which is the Deficit Reduction Act. Also Patient Safety and Quality Improvement Act of 2005 also. Then we have the Tax Relief and Healthcare Act of 2006, Genetic Information Non-Discrimination Act, American Recovery and Reinvestment Act, Patient Protection and Affordable Care Act, and Medicare Access and CHIP Reauthorization Act of 2015. So this will be the conclusion of our first lectures. Again, these first lectures, we are not studying anything in details yet. Just we should know the whole concept. We discuss a little bit about the historical concept of healthcare delivery, both prehistorical and in US. We also discuss about the structure of a healthcare organization. And again, we see in our lecture number 2, which we may go more details now. Thank you for your time.